So our guest today on the Docpreneur Leadership Podcast and broadcast is Arden O'Conner. She is the CEO and founder of O'Conner Professional Group, which is a behavioral health navigation firm. And I'm going to let her share with you what that is and what it is doing among its patients and physicians out there. So Arden, welcome to the broadcast today.
Thank you, Michael. Really excited to be here and talk about a subject that's important to me. O'Conner Professional Group was founded 9 years ago. We work with families who have addiction, mental health disorders, and autism spectrum disorders in their family systems. We don't do individual therapy, but we coordinate care. So we'll find provider teams for families. We will help do interventions if somebody is resistant to getting help and needs to be in a placement and a family is struggling with that process. We'll place people into residential programs all over the country. And then we do a lot of in-home coaching, and it can be a few hours a week of somebody doing some meal support for eating disorder patients or drug testing someone through full live-in 24/7 coverage for someone with a psychiatric or addiction issue. And I would say we are firm partners to concierge practices, both individual practitioners as well as larger health advisory firms. We find that a lot of physicians will be working with a patient who's got medical complexities or perhaps a co-occurring disorder, a complex trauma history, and they're presenting with some challenges in the medical arena, but they also have these other issues that are preventing them from living, full lives and productive lives. And so the concierge physicians will call us to come up with a game plan, either in the home or in a facility, to help monitor progress and work closely with them to optimize the outcomes for that person.
Wow. Well, and today's topic is managing anxiety with patients and clients and employees during the pandemic. We're all struggling to manage emotions, personalities, kids, staff, patients as well. For many doctors out there, you have the worried well. You have those who pretty much have been home since early March, who are in very senior, and they talked with one couple that said, I'm just, I'm not necessarily worried about going out, but I have enough health problems as it is right now, respiratory and so on, that if I do go out and I did by chance get it, this one just might do me in. So I'm just going to stay safe and stay home. So before we jump into this topic, in your expertise, your opinions, what you're seeing out there, conversations and so on, how has COVID really impacted the rates of behavioral health issues?
So what we're seeing are increases in anxiety, depression, alcohol abuse, and domestic violence. There are some statistics out there that suggest, I believe one of the statistics I saw was that a national crisis line had 1,000 times the rate of typical call-ins that they did in, I think this was in the month of April, than they do typically, due to crisis calls from the home. I think if you think about the general population, about 10% has an alcohol or an addiction issue. Depending on what study you look at, it's about 25% report anxiety or other mental health issues. If you look at some of the few, not that many studies out because it's obviously brand new information, but there's been a couple of charitable trusts that have done some surveying, and it looks like the population, 45 to 60% are reporting signs of anxiety. And for me, the way I think about it, I own a clinical company, but I myself am not a clinician. I look at it and say, is this more of a situational anxiety issue? So are people triggered because of COVID and its impact? Are they afraid for their health? Are they anxious about the economic future, their job security? Quite honestly, when we originally talked about this topic a month ago, it was very timely. And as the weeks wore on, I thought, well, maybe people aren't feeling as anxious anymore. And as I just mentioned earlier, all of a sudden the news comes out with a report that at least in Massachusetts, a few towns are looking at closing schools, at least partially. So remote learning will continue with some in-classroom support. And I can tell you, knowing my clientele, their anxiety roots, just reading that article, are going to go through the roof. Yeah. So I think the important thing to think about is, I think in general, the population as a whole, given what we're seeing, the anxiety rates are higher. I think the question is, are there folks who also had anxiety issues to begin with, who are also being triggered during this pandemic? And I will mention one nuance that I think is pretty interesting. we do have clients who have things like social anxiety, where they're nervous about being out in the world and interacting with people. They actually are very comfortable during this time. They're allowed to be in their homes, have a very, what I would consider a pretty narrow focus in terms of their lives. They don't do as much Zoom, conversations. They are not forced to go out by their family or by a provider to go out into the world and experience things. So this time has been comfortable. I think for them, the challenge will be when the world starts to open up again, how that plays out for them and their disorder.
Well, and I feel like especially in the mental health field and for now is a kind of a rebuilding time, or an interpersonal time of reflection, where I've got some extra time maybe as a physician to think about what's coming down the road. And we'll talk about, and I've got a couple of questions here for you. Number one is, what are the signs and symptoms of anxiety that physicians, particularly concierge physicians, should be aware of? But before we tackle that, let's reverse one more question, and that is, this is when kind of everything is happening. The last couple of months, we've seen an increase in alcoholism. We've seen an increase in domestic violence, domestic abuse. Certainly the calls, the data is starting to be is actually happening. It's the police are being called out to the to the hospitals. Police are being called out to the homes. They're inside the family units. We're starting to see some prescription abuse. This is when we're starting to see where the data actually comes from in this time. What are you concerned about, or what because we were listening to the governor the other day talking about the rise of all of these mental health issues and these domestic abuse issues and sexual abuse issues. What are you looking for on the horizon as the data comes out later this fall, this winter, that's saying, I'm not going to be shocked by this, but I know a lot of people are, and we need to address it now and be ready to address those things, because this is what's happening in our communities right now?
It's a great question. I think the rates that we're seeing rise, I think the hope for many people, including myself, was you have this pandemic, they put restrictions in place, people hopefully follow them, the pandemic starts to flatten the curve of cases, and then things slowly start opening up, and we see improvements in rates of alcoholism. People start to feel less anxiety because things go back to maybe a new normal, but a normal existence, quote unquote. Again, I think the concerns I have are a couple of things. One is, in addition to the pandemic, we now have major incidents of racial inequality and violence that are coming at us in the news. So if anxiety was starting to slow around the pandemic, I can't imagine that it isn't on an uptick, and trauma, frankly, for people watching, whether it was George Floyd's death or the many other incidents that we've seen. So I think that's something to consider. I do think if we get a second wave of COVID, I think people's tolerance for the strictness of the regulations and the restrictions is going to be probably decreased, because people have already been upset about not experiencing their summer and not being able to do things, and they've gone back to a little bit more freedom. So I think I would worry that we would see another uptick due to that. I'd say the last piece, and this is probably for me the biggest concern, is the economic uncertainty. So when we see major layoffs, when we're seeing companies, huge companies, furloughing vast amounts of employees, all the issues that you've talked about do not get better with people with less economic certainty. So if somebody has an underlying alcohol abuse issue and they're maybe drinking outside typical norms, but they're holding it together because they have to be at work at 9 a.m. in the morning, if all of a sudden they don't have a place to be accountable to, they lose a sense of their identity. Alcohol becomes then the standard coping mechanism, and you go from somebody who's maybe drinking too many drinks in a day, who is now physically addicted to alcohol because they're starting much earlier. And that's one small example. So I think the economic piece is the one that I'm the most concerned about. And I think as you talk about rates of abuse and violence, I run a concierge firm now, but historically I ran a group home for kids in the foster care system. Right now, I don't know that our states, at least Massachusetts, which I can speak to specifically, have a plan for figuring out, how are they going to handle this uptick? If you watched, I was very involved in social, this Department of Social Services in our state systems for years. They already were at very high caseloads. Now, if you're having increasing calls to the home, I don't know how that is going to, I don't know how they're going to have the capacity to address it, particularly when we're in an upcoming recession. And on top of that, which is not discussed as much in the media anymore, even though it was for the prior probably 2 years, we are still in the middle of an opiate epidemic. You know, we're seeing maybe less deaths from heroin, but increased deaths from fentanyl. So unfortunately, and I don't mean to be the Debbie Downer because I like to be the bearer of positive news, and I'll get to the hope in a minute, but I think in general we have a, what's the word I'm looking for? We have a combination or a coalescence of many challenges, from the economic uncertainty, medical issues, political unrest, racial inequality, and then all these other issues that, frankly, anxiety rates were already on the rise prior to COVID. So it's a really interesting time and a really difficult time, I think, for both individuals and for employers. I think the one thing I'll say about hope is that with publications around COVID, you know, impacting low-income communities in a really significant way, I think I've seen more publications dealing with anxiety in the employer workforce in the last 6 months than I've seen in the past 5 years. With these issues coming to light, and employers, and we're seeing a few who are contacting us saying, what platform can your firm provide us? Or how can we get an in-house therapist? If people start to move towards these as options and solutions instead of shying away from it and saying that's not our place, that's where I see the hope, because these issues can be addressed, they can be addressed earlier, and some of the dire consequences of people losing jobs or getting arrested, all those types of things can be hopefully prevented.
Well, and before we pivot off of that, how are employers addressing, and what creative ways have you seen them addressing mental health on site or maybe even remotely? Is it something that is only for the big firms, you know, for the big companies? Is it something that, you know, a small business, you know, 10, 15, 30, 50 employees can do? Because we are starting to see that that's where the healthcare dollars are being spent, and we can, you know, maneuver some of those dollars maybe over to here to help our employees.
Yeah. So I think there's two questions here, and I think I will start by saying every size company has an opportunity to address mental health and wellness. I really believe that. The extent to which you do it, how many financial resources you put behind it, depend on your business model. So I can't, you know, make a decision for every company. Big companies, I think this has been a priority for a while, both for moral reasons, because people want to make sure that their employees are supported, but also for business reasons. We know that loss of productivity, you know, that alcohol abuse and anxiety and other mental health issues are a major driver of loss of productivity and a major driver of turnover, which it negatively impacts the bottom line of companies. We also know they're major drivers of healthcare claims costs. So we had one company come to us and just say, we reviewed our claims data. Behavioral health was the largest pool of money that we spent as a self-insured employer based on the claims data. So there's both business and moral reasons to look at it. I think for bigger companies, you see chief wellness officers, you see modern versions of EAPs, employee assistance programs, that better target what employees need, which is, in my opinion, an immediate access to vetted providers. So historically, employee assistance programs would get you a chiropractor and they'd get you a therapist. They were a referral source, and a lot of times they couldn't provide data that was fresh. They weren't necessarily known for having specialty in behavioral health. There are all sorts of newer versions of platforms that allow employers to quickly access a provider in the person's network of insurance and give them some options and tell them when the availability is. In the same way that concierge doctors make patients like myself, I'm a consumer of concierge medicine, very easy to get tests done. These modern versions of EAPs, our company does a little bit of this work. You know, they're making it easy for employees of big companies to find solutions to their behavioral health challenges. So that's one option. I would say on the other end of the spectrum, for smaller companies that don't necessarily have that broad of a need, I think there's a lot of things you can do. One, you can know about, you know, who is a local professional, whether it's a firm or an individual, who can be there in the case of an employee in crisis. Whether you're making a direct referral to that professional, or whether the firm is covering some of the cost in the beginning, depending on the situation. And I've seen companies do it all sorts of ways. I'd say more broadly than that, with just even your internal resources, especially during something like COVID. Harvard Business Review had an interesting article that said 90% of employees want to be asked how they're doing during the pandemic. 29% wanted daily communication by their employers, and this was in March, so the height of the pandemic, about what they were doing to protect their safety and just overall employer messaging. So, that gives you a sense that employees want to be asked how they're doing. Our company did very small things like there's a company called Spoonful of Comfort. They have soup, ladle, and rolls with cookies, and it really is, it's beautifully packaged. I think it was $80 a package. We sent it to all of our full-time and some of our part-time staff as a reminder that we are thinking of them during these times. It's a very, I've heard, we also made an effort to reach out to employees individually, particularly those employees who had higher risk scenarios. So their family member was an essential employee, a healthcare worker, a police officer, a therapist. They had elderly parents in an assisted living facility. They themselves were immunocompromised. We tried to do our best to kind of not send out just a blanket statement, which I think every company should do, but also individualized emails. And supervisors were asked to be more on alert to kind of look for signs and symptoms of somebody struggling and reach out proactively so that employees kind of knew, boy, I'm thinking of you during this time. And I think, again, getting back to that message of hope, if there's one good thing that has come out of this pandemic, I think the fact that people want to be asked how they're doing, this HBR article gave me a lot of hope that I don't know that employers will feel it necessary to shy away from asking and checking in on people in the same way that was done before. I would often hear HR directors say, I don't want to overstep boundaries, or I don't want to look like I'm intruding in someone's personal life. I think this is a time when all of us, from the many events that are going on in our world, are feeling heightened levels of stress. And I do think it's an opportunity for employers to think through, what's our messaging? How are we individually tailoring our approach to really fit our culture and our firm's needs?
Wow. And you can see how, HR managers maybe need to reassess during this time how they're being trained because, they're managing emotions, inside of their offices. They're managing the psychology and the mental health and well-being of the company, but also individuals, kneecap to kneecap. But what, we know that in talking with a number of concierge doctors recently that, some of the number one things that they're talking about inside of the exam rooms are mental health issues. I've got an elderly parent. I've got a kid that's just, difficult. It's not even health reasons for that individual. It's, and I was talking with one, and I shared with you the other day, the doctor had said, it is amazing how many times those patients, my patients, are in the exam room talking to me about relationships and the struggle that they have personally in their marriages or in friendships. And, because I am a friend to my patients, I have a closer relationship with my patients as a concierge physician. And, what strategies can physicians offer to their patients that are practical and, something that they can leave the building and say, I'm going to do that. Like, that was a really good idea. But also for employees to maybe better manage anxiety. And you mentioned the HBR review, which is very encouraging.
I guess what I would say is it requires some planning and some bandwidth, which I know is tough for concierge medicine doctors because they're already, despite having smaller patient panels, they still have a lot of patients in need, particularly during this time. I think that said, the best advice I can give is to find multiple types of referrals that you can make. So trusted partners in your local area, dependent on the situation. And I say different types of referrals because, to your question, you may have somebody in the exam room who is admitting, my husband drinks too much and I don't know what to do about it. And a physician may have 15 minutes to have a heart-to-heart with that patient, which is a gift in and of itself. But the best thing, in my opinion, that physician can do is then encourage that patient to go get additional supports out of the office, because even the patients that need doctors the most are probably not seeing them every week, and they're not using them for therapeutic purposes. And I think the physician's bandwidth to manage a crisis, should it occur, is going to be challenging. So in that example, I think having an addiction specialist in your local area where you say, this is somebody who you can go talk to, who can provide you some guidance. I think the other piece on the relationship side, suggesting seeing a therapist is a delicate issue. I would say I'm a Gen X person. Gen Y and the millennials are very comfortable. They talk about seeing therapists. I mean, this is a generalization, but it's it's not as stigmatized. Suggesting to my father, who's in his mid-70s and he's Irish Catholic by descent, so the solution to everything is you hide your head in the sand. He is probably going to be, he wouldn't be put off by that suggestion, but he certainly wouldn't take it seriously. So I think the question becomes, could you have a different way of packaging services? Could you find a relationship coach or a life coach or an executive coach in your area, so that as a person's describing the scenario, you can have, ideally on a piece of paper, a vetted list of folks that you feel comfortable with, perhaps even by diagnosis or severity of issue, that you say, I really, and to me, the conversation goes something like this. I'm so glad you trusted me with this information. You have whatever degree of conversation trying to guide them to the extent you're comfortable. I want to make sure you get the very best help. The same way I provide you the best medical care, I want you to get the very best emotional or psychiatric support for these issues. Are you comfortable with me sharing some of the resources our practice has developed? And really giving that as a takeaway. I think that's probably the most powerful thing you can do. And maybe the patient walks out of the office and says, I'm not going to do that. But at least a doctor feels like at the end of the day, they gave them an opportunity to get ongoing support. And honestly, part of the reason I have this statement is because I feel like while doctors, especially concierge physicians, want close relationships with their patients, as somebody who's managed a concierge behavioral firm for 9 years, I'm not sure that they want the level of intensity that comes with trying to manage a patient, either who themselves or a loved one has a significant mental health issue. It's very crisis-driven work. It's not work necessarily built into all their business models from a cost perspective. And it's not to say they can't be helpful and they won't be involved. And if they're prescribing medications, they could be part of the team. But I think most of the physicians I've seen are relieved when there's somebody else in the picture who's managing, okay, they didn't go to their therapist today, what are we going to do? Or this person actually needs to be sent into a hospital because they're a danger to themselves. And it's not, again, that they don't have a role, they don't want to be kept updated. But most concierge physicians I know don't necessarily want to be on the front lines or the first call of those situations.
Yeah. Well, and that having a referral list, I know it seems, because from my wife's perspective, I think that the last time she was given a referral, it was, here's the business card. I don't deal with that. Go call somebody else. Here's somebody I recommend. And it was received as, well, that was insensitive. Like, you showed me that you don't care and you would rather just pass me off to someone else. And so, I think that having a stronger list of referrals in the area that you and your staff together, and it doesn't have to take forever to put together this list, but it has to be a local community list. And it has to be someone that you delegate, maybe your operations or your VP and say, your staff person, and say, I want you to find some executive coaches. I want you to find some mental health professionals. I want you to find some psychiatric professionals. What else? What else does our community deal with? Whatever it might be. And then when those questions come in, you have a brief conversation in the exam room and say, here's the list of options for you, because we love options as patients. I'm not a physician, but I know what it's like to sit on the other side of you and, feel like I'm being passed off and that you don't care. And we talked a little bit about the data, earlier off air, that patients today have a typecast of many professionals. And when we think, oh, I need to go get mental health, they're just going to put me on drugs that are going to make me weird, and I'm already weird. So, PCPs are typically, whether you're in concierge medicine or not, they know, and they've told us, look, we're not trained mental health professionals. We didn't take a ton of those courses. And so, but yet they are faced with every single day impossible situations, impossible conversations. that really, a lot of them circle around relationships, mental health issues, addiction, and so on. What are some of the signs and symptoms of anxiety that concierge physicians in particular should be aware of? And how do they cope with those?
Absolutely. So if you don't mind, I'm going to jump right into that, but I want to just make one last comment because I think you brought up a great point. The language with which you make a referral, in my opinion, makes all the difference. And one point on the last question related to how do physicians build sort of a network of professionals. This can be part of a broader initiative. Again, if you're lucky enough in your practice to have a VP of operations, so my concierge physician offers educational webinars by a nutritionist. Some concierge practices I know have a social worker embedded, either full-time or they're in their practice a few hours a week, who can help with these referrals and listen to some of the initial. They're not going to be lifelong therapists for the clients, but there's somebody who's there to make an evaluation and some types of recommendations. So there's, we've done actually some work for concierge physicians in that regard as well. I think there's all sorts of creative structures, and even if it's a list that you keep, but you may even have podcasts or a section of your website for patients that is dedicated to resources. This issue of behavioral health is not going to go away, and I only bring it up because I think the more proactive you can be to support patients in this regard, the better it will be when there's a moment of crisis. So I just wanted to say that before the moment passed. But to your question around signs and symptoms, I mean, there's some very common ones. People actually can have physical symptoms of shaking in extreme circumstances, shortness of breath, almost like what we see in the movies, like a panic attack. I would say more common symptoms are somebody perseverating on small issues or big, but really can't get out of a loop of thinking and is nervous. Their level of nervousness is outsized by what they're nervous about, if that makes sense. So they're really concerned and they're talking very fast. Some would say I'm anxious all the time because I talk very fast. But they talk very fast, and they have a level of energy that's different than what you see in a typical moment. We also see, I think, the other sign that, so it's I would say it's hard for concierge physicians to know unless it's a more dramatic response, because if you're on average seeing a patient once or twice a year, and most people go into a doctor's office, they pull themselves together, they're going to show up as their best selves. Not everybody, but a lot of people will. It's usually in the series of conversations that it might come out. So a concierge physician, mine always asks me, how many drinks in a week do you have? But even if there's a common question, has anything changed in your life that's caused any anxiety? Opening the door can be a way that concierge physicians get a result. The other way that concierge physicians will see it, and this is trickier, and this is not just for anxiety, but it's true for alcohol abuse and depression, is a family member comes in. So I know of a family where the husband actually had cirrhosis of the liver due to alcohol abuse. The wife knew it, but the concierge physician's in a tough position because of HIPAA. How much can they disclose? But it is common for our clients, at least, who go into the family doctor and they say, my husband has this issue, I don't know what to do. So I'd say that's another way doctors see it. And then you have all the ways that people cope with anxiety, which is, again, some of the things we talked about early, abusing alcohol. Sometimes we'll see patients who can be particularly med seeking. I'm so nervous, and their first answer is, is there anything you can give me for that? And, I'm not a physician. Physicians have to determine their own prescribing practices. I personally think if the person has had any history of abusing substances, quickly prescribing medication is tricky, and it should be done carefully, either through a physician who's seeing a patient regularly, or ideally through a psychiatrist who's monitoring that medication while the patient is seeing a therapist and working on mindfulness and other yoga or other meditation techniques. We've just seen a lot of situations where somebody goes, our patients with addiction are pretty savvy, and so they will often doctor shop and find somebody who will prescribe something that they may or may not need, and they will wait until they get somebody who will do it. So that's the only caution I would say on the medication side.
Well, it is tough, especially, you hope that your doctor can help you, but sometimes, you have a loved one or a family member, or, usually it's a blood relation, and you're trying to help them, and HIPAA is restrictive, but you want to talk to their doctor, your family, your mother, your daughter, whatever, to say, they're not going to tell you this stuff. And they've been hiding this stuff from you. And, you'll get the call from the police or the sheriff and say, what's going on here? Certainly it is concerning how we trust our PCPs to help us, but yet their hands are tied as well to say, I feel for you, I just don't know what we can do. So in those situations where you are a concerned family member, trying to go to a doctor or their doctor, it's not your doctor, but it's a family member's doctor, and have a conversation. How, I understand that you've got your limited time, that you can see me, that you're going to listen to this, because I'm not even your patient, so there's no incentive or reimbursement for you to listen to me, but I'm concerned about this family member, and I don't know what to do, and I need you to be aware of this. And so that your opinion kind of is shaped by some of what I'm saying, because they're hiding this stuff from you. So in those circumstances where the person won't get the help that they need, and that they're kind of, something's a little off with that patient, and then you do get the concerned, loved one that comes in and says, yeah, you need to be aware of this. You just kind of drop a bomb on the doctor. How does that happen? What's your, opinion of that? How can loved ones navigate that with a doctor, but also what are doctors doing to be proactive with that?
Great question. So our patients do it all the time. Our clients do it all the time. And when we talk about patients and clients, we really consider the whole family system our client. So we often have one person on our team coaching family members and a different person working with the person with the behavioral health issue. And we call it, a one-sided conversation. A mom is very concerned about her daughter. The daughter is 21 and said, I don't want my mother being able to talk to my therapist, so there's no release on record. And the mom is calling the therapist repeatedly and saying, she didn't eat this week, what do we do? I need you to call me back. And the mother's also doubly as angry because she's paying for the therapist. Like, this is a common scenario for us. So I think those one-way conversations do happen. I actually think we do suggest them to clients at times, not always, depending on how well the client can be succinct in what they have to say and not be repeatedly calling the same provider over and over. I think one or two one-way conversations make sense. And I say that they make sense because it can give a doctor information. I'm thinking particularly of, questions of the patriarch who is a high-functioning alcoholic or has bipolar disorder but doesn't exhibit those symptoms in the office. If a family member tells him or her, the doctor, this is what I'm seeing, he's not going to tell you this, you don't need to respond. You can do it in a, professional manner or a way that's at least the doctor's able to hear. The doctor then can ask questions of that patient. They don't have to say, your family member saw me. Some doctors will feel that they need to, and will often tell our family members that, and I think that's fine too, as long as everybody's clear with where the information is flowing. So that's an option. If a family, sometimes what I've seen is a physician will say to a patient, so like Judy is calling about her husband Bill. She's calling Bill's doctor. Bill's doctor says to Judy, before you tell me anything, just know I'm going to have to tell Bill that you came to talk to me. Some will take that approach. Some will just listen, not comment. And then when they meet with Bill, say, have you been feeling this? They'll ask prompting questions. Have you noticed any changes in your mood? Have you ever considered this, to see if they can elicit the information naturally? I think for doctors where that relationship gets tricky is if Judy, I'll just keep using the same example, is calling Bill's doctor every 2 days saying, what are you doing about this? What are you doing? Because it's not necessarily a doctor's place to try and fix a solution if a patient doesn't want to. I mean, they can give their best guidance, but I've known many doctors who have advised people with cirrhosis of the liver, you need to stop drinking. And the patient's like, yeah, great, I'm not going to. The next step for a doctor, in my opinion, is either to make a referral to a therapist, or ideally, and this is a little bit trickier, and again, we're happy to be a resource if folks need names. So an interventionist is probably the most applicable situation. If Judy is saying, Bill won't talk to me about it or he denies it, I'm telling you, you need to help, and the doctor has done what they think is reasonable for them to do. The next step, and the reason I say an interventionist versus a therapist is most therapists are going to ask Judy, how do you feel about Bill's behavior? Or they're going to guide her on possibly what to say to Bill, but it's going to be more of a retrospective look at feelings as opposed to a practical directive guidance. Interventionists will assess the situation and work with Judy to see, how do we bring this conversation to the forefront? And that might include, if the doctor is open to it, the doctor having a piece of the conversation. Most of the time physicians aren't. Most of the time physicians say, like, it violates my relationship with this patient. It would make it impossible for me to ever work with him again. But I've seen some examples, one case in particular where a physician had repeatedly told this gentleman that he had cirrhosis of the liver, he was going to pass away, and then opted that he would disclose some of that information to his wife for the purposes, wrote a letter for the intervention. He didn't physically come. So long-winded way of saying that's another strategy for families, because I think it then positions the doctor as the expert, but it also allows them to draw some boundaries around what they can and can't do in their practice.
Wow. Well, and our guest today is Arden O'Conner. She's the CEO and founder of the O'Conner Professional Group, and we're talking about behavioral health navigation, managing anxiety among patients, and a number of great topics today. So we have a couple of questions as we come in for a landing with Arden O'Conner today. Let's talk about the percentage of the population that's experiencing anxiety and other mental health issues. Where are the resources? What are the external resources? What are you guys doing that physicians can be aware of to help patients manage anxieties? Because, it seems like some places are opening, anxieties are going to come down a little bit because we're going to be more free to go and do things. We'll be bored in new places with new scenery. But, what are some of those external resources? And I'll let you kind of jump on those questions.
Sure. So our firm offers stress management coaching. We do a lot of mindfulness work with our clients. We do coaching with both family members and the individual. And I won't bore the group here with the long list of services. We do interventions. They're all on our website. I would say other places to look for resources. I think the National Association of Mental Illness, which is a nonprofit, it's a national nonprofit. They have a helpline. They have a list. It's www.nami.org. I think they're a phenomenal resource. I'm sure all the physicians know of Psychology Today, which helps you search by zip code and you can specify anxiety as an issue. I would say right now, given that so many of the practitioners across the country are doing telehealth, there's a group that we've worked with called eHome Counseling, and they are exclusively a telehealth provider, but they have therapists in all of the state and all 50 states. So I think they're a great resource if folks are just looking to manage this virtually. I also point physicians and our clients to very practical resources. I know now studios are depending what state you're in, some are open or some are not, but I'm doing in-home yoga on Amazon Prime with the video. I find it enormously helpful. Insight Timer is a very inexpensive app. All sorts of guided meditations, courses you can take, self-paced learning around, and they do have ones on managing anxiety and stress. I would say that's for probably a less acute patient than someone who's really struggling. And where we draw the line is if somebody is struggling with completing daily activities, they can't get out of bed, not eating, family members are concerned, in the same way you'd think about alcohol abuse, like that's sort of where the line is that, Insight Timer is probably not enough and they probably need professional support. So those are some of the resources, and we have a list of resources in addition to our services descriptions. We have a list of resources on our website, and actually a full webinar on managing anxiety with employees and clients that's got some slides as well.
Great. And we will link to that so that you'll find more information about Arden and how to connect with the O'Conner Professional Group in the links above and below. And Arden, our last question for you as we conclude today in the first part of this three-part series with you. And I want to thank you, first of all, just for addressing the topic of mental health, because especially in in concierge medicine, I think, the concept is, well, this is only for a certain demography. And it's really not. It's for a lot of different age groups and levels of educational people and non, people all over the board who join these types of practices. But the topic of mental health in concierge medicine is something that, everybody is trying to tackle mental health and opiates and opioid crises and things. But mental health is so important in a concierge medicine office, and they're dealing with this because they have a closer relationship with their patients. And I think that these physicians out there don't get and you guys as well, don't get the credit you guys deserve, because it's one of those things that kind of just gets written off. Well, that's just concierge medicine. You just get in to see the doctor quicker, and you get a little more attention. But, it's so much more than that for so many patients, for so many doctors. So thank you for what you're doing. But if you were to, hang up your spurs today, close down the office, hand over the keys, and say, you know what, that last patient or that last family, we did it. Like we could die happy today, knowing that we accomplished the mission and the vision. What's an example that you might have? And there might be a few. I ask this question a lot, and it's like, wow, man, which one do I choose?
There's always, I mean, there's several examples I could give. I think because I like to be challenged, would choose some of the hardest situations. And I'm imagining these are ones that are concierge physicians face all the time. So it would be a patient with comorbidity. So substance use and bipolar disorder, substance use and anxiety. It would be likely a male who's older, who has earned the money in the family system, because for a whole host of reasons, I have found particularly older Caucasian males are, and depending what demographic group they come from, but that sort of joke I made about my dad, that's a common feeling. Like, I don't need help to do this. I have a job and my issues can't be that bad if I'm working. We hear that kind of denial all the time. And the reason I specify somebody who has made the money is because it becomes more difficult, just candidly speaking, for a wife or a child to come in and try and intervene on a family member when they're financially dependent on them. And the person has, oftentimes we deal with we deal with a range of folks, but a lot of folks who are very powerful, run big companies, have enormous amounts of wealth, and they're looked up to in so many regards. So family members, friends, the folks that would come, and if I were to get in trouble, the people who would come to me, it's a harder dynamic to do it when someone's been an icon in their community to kind of do that level of intervention. So if we could come into a scenario like that and help, not only to help the family intervene, but start to change the dynamics in the family around how do they think about addiction? How do they look at their own family culture and their dynamics? And how do they start and get somebody on a path to recovery? For me, that would be a big win. The last reason I'll say that is, when we started the firm, we had mostly clients between 16 and 25, large population of opiate users. We now are seeing that demographic plus a demographic of people over 65 with alcohol and psychiatric issues that have probably been latent for years, but because they were working and had other structures, it wasn't that significant. We're now seeing that demographic being particularly hard to treat, not only from the mentality perspective that they have, but they've had ingrained patterns of behavior for a long time. And if alcohol is an example, if they've been using that in their system, it can affect their cognitive functioning, it can affect their liver functioning, all sorts of things. So if we could kind of get into a case where Judy comes to us about Bill, we work with Judy, we get her and her children into a place where they feel more comfortable talking about sensitive issues with Bill, and Bill gets into some form of a recovery program, AA, meditation, smart recovery, I don't care what, but starts to really look at his life and say, I want to die with the dignity and grace and legacy that I had hoped for, that would be a real win for us.
Wow. Well, our guest today has been Arden O'Conner, the CEO and founder of O'Conner Professional Group. It's a behavioral health navigation firm. Arden, how do people connect with the O'Conner Professional Group, connect with your resources? What would be the good place to start when they conclude this and they say, absolutely, I need to reach out to her, get some resources, watch some webinars?
Sure. So our website has a lot of information, www.o'conner, OCONNOR, P as in professional, G as in group.com. My cell phone number, believe it or not, is my work number. It's 617-290-9818. And folks are always welcome to reach out to me at aoconnor@oconnorpg.com.
Wonderful. So if I was to text you, or a physician listening was to text you, would I actually be texting you, or am I gonna, like, 4 days later, oh yeah, you called, right? No, I texted, but thanks for returning my call.
No, I think, and we've talked about marketing a concierge practice. I am not a clinician. I am a business person. The clinicians are on my team. If I am nothing else, I am very responsive, and we have done a lot of work to train our team on customer service expectations. So, there may be a day where I get 10,000 calls and texts and I have to have someone else, triaging. But for now, we're incredibly responsive because that's what our clients expect of us, and that's why they're paying us to engage in our services.
Absolutely. Well, thank you, Arden.